Welcome to this edition of Research Connection. Joining me today is Dr. Valery Scharf and Dr. Kenny Carroll. Thanks for joining me. Tell us a little bit about yourselves.
So I'm Valery Scharf. I'm faculty here at NC State as we get dropped on by a bird. And I did my undergrad at Stanford University and then vet school at Texas A&M, and then rotating internship at Ohio State and residency and master's at University of Florida before coming here as faculty about 8 years ago almost, and started in a clinical track role and then switched to tenure track a few years ago. So I'm an assistant professor currently.
And my name's Kenny Carroll. I did my veterinary training in Australia, graduated back in 2017 from Charles Sturt University. I worked as a vet for a year in private practice back home, and then moved to the US in 2018 and completed a rotating internship at the University of Georgia. And now I'm here for my surgical residency, which I'm now in my third year.
I guess we should specify we're surgery. Yeah.
So surgery, yeah.
Small animal, so soft tissue and oncologic surgery, and then Kenny's residency in orthopedic and soft tissue.
And you recently received a grant towards that, correct?
Yeah, we did. So Kenny, if you want to talk a little bit about our work that led to the grant.
Yeah, so myself and Dr. Scharf are very interested in minimally invasive surgery. And then for my residency project, we looked at a new type of novel technique in portosystemic shunt attenuation, specifically for portoizygous shunts, which are a particular type that we see in clinical practice. My residency project was more so of a cadaveric study, kind of investigating a new approach, which we had published in veterinary surgery earlier this year. And then we're now kind of using the findings of the cadaveric study in clinical patients, and we're working with the University of Florida, and specifically looking at amyloid constrictors and their efficacy for attenuation of this type of shunt in animals. So
yeah, so it ties in nicely, as Kenny mentioned. We're pretty interested in minimally invasive surgery, especially thoracic surgery. So in dogs and cats, unfortunately, the thorax is a little bit harder to access and maneuver around with a scope because it's pretty rigid and you have to dodge lungs moving in and out. So that presents some challenges, but we've been really working to try to develop minimally invasive ways to treat thoracic disease, because there is such a big difference in a patient that has a full thoracotomy, so a big incision to go through the chest wall, versus when you're able to treat disease just by putting in a few small surgical incisions. So Kenny's project tied in nicely to that, because if we can show that this is a reasonable way to treat this disease, then that's going to really avoid a lot of morbidity for patients who have portoizygous shunts. And similarly, we've been working on novel treatments for spontaneous pneumothorax. So that's a disease where basically there's a bulla that leaks air into the space around the lungs. And traditionally, they've been really hard to identify. So you have to go in through a big open approach to look at all the lungs. But we have another clinical trial going where we're looking at using a special scope that can curve around the edges of lungs a bit more effectively, to see if we might be able to get to a point where we can treat that disease successfully with just a scope as opposed to a large incision.
It's pretty clever.
Yeah, we think so.
And any collaborations you wish to highlight?
Yeah. So it's very important, with minimally invasive cases, especially clinical trials, because portoizygous shunt, spontaneous pneumothorax are not the most common cases, so we're not seeing them every day. So we're fortunate that we have some collaborators at the University of Florida been working with us on Kenny's project, and they've actually done one clinical case. We've done a couple here, and then on the spontaneous pneumothorax case series, we have a group at the University of Guelph at the vet school there that's been scoping some as well. So it's been nice to be able to maximize what we can do in terms of getting cases in and recruited for these studies.
Sounds like good work. Thank you for sharing.
Thank you.
Best of luck.
Thanks.